staying healthy, staying sexy, staying young is what living life is all about. And if you have doctors that have proven treatments that keep people young and healthy so they don't get sick, you want people to know about these treatments and that they exist.
This episode is brought to you by Gainswave. Gainswave is a treatment done at your doctor's office to optimize erection quality without the needs of Viagra, Cialis. It's non-surgical, there's no needles, and it has an amazing success rate. To find a Gainswave provider, go to gainswave.com. That's GAINSWAVE.com. This is Mark L. White with Health Hacks, and today I'm with Dr. Bill Cimikoski with the Utah Stem Cell Joint Treatment and Wellness Center. Welcome to the show, Dr. Bill.
Thank you. Thanks for having me.
So obviously you do stem cells, but what is stem cells?
Well, when I first started doing stem cell regenerative treatments, this was about 10 years ago. I was the first medical doctor in Utah doing these types of treatments. And I had to get the word out. People had heard about stem cells, especially back in the 1980s, where there was a lot of talk about stem cell research when Christopher Reeve broke his neck, Superman, and then there was a lot of congressional hearings about embryonic stem cells. And that's really where people first started hearing about stem cells, was to help spinal cord injury victims. And so back when that was happening and those congressional hearings were happening, the one concern was where we got the stem cells from, because originally we were talking mostly as scientists about getting stem cells from embryonic tissue. Those come from aborted fetuses, and then there was an ethical dilemma. How do we get stem cells without promoting abortions? And that kind of halted the science from evolving more quickly because of that dilemma. And but now we get stem cells from other sources. So the first thing I want to do is address your question, which is, what are stem cells? How are they used? Well, we all have stem cells in our body that are laying dormant, just waiting to be told what they need to do. The stem cells are what helps the body regenerate from any type of injury or ailment. So I like to give a couple different analogies. So if you step off a curb and you sprain your ankle, that's a tearing of a ligament. And your body will immediately send platelets to stop the bleeding. And then the platelets have a lot of growth and healing factors that help the stem cells achieve their goal. Stem cells that are laying dormant in your body, mostly in the bone marrow and adipose tissue, then migrate through the bloodstream to the site of injury. And in this case, it arrives to the ligament. And when it reaches the ligament, it turns into ligament cells or ligament tissue. Those same stem cells will turn into skin cells. If you cut your skin, then the stem cells will migrate to the site of injury and become skin cells once they arrive. If you have a heart attack, those same stem cells will arrive to the heart muscle and try to regenerate the heart muscle and become heart cells. So that's kind of how stem cells work. They're made. Their primary goal is just to turn into whatever injury the body has sustained. The stem cells are there to regenerate and heal it.
As we get older, though, do we lose our stem cells? Are stem cells less potent? Because if not, what's the point of stem cell therapy at all?
Great question. So you do lose your stem cell potency, and also the amount of stem cells you get. You lose as you age. And even when you're young, stem cells do a great job of regenerating some things in your body and doesn't do such a good job at regenerating other things. So for example, the analogy I gave you with the skin, the body does a great job healing skin. It migrates through the bloodstream, it arrives at the site of injury, and you put a bandage on a cut you have on your arm, and it'll heal in a few days or a couple of weeks, depending on how bad it is. But your body does a very poor job of sending enough stem cells to regrow cartilage, for example. And so many of the treatments that I do are designed to help people with arthritis, for example. The longest running application of stem cell use is really in the musculoskeletal field. We can use stem cells to regrow cartilage, tendons, ligaments, meniscus, labrum. All these things can be regenerated with stem cells. That's how your body regenerates them. And yes, you do A lot of times when you have a body part that's not healing well, that's what arthritis is. Arthritis is a wearing and tearing down of the cartilage that we all get with age. And when your body doesn't send enough stem cells to keep up with the damage, then you have a disease called arthritis, and we all have it. And yes, as you get older, your body's stem cells become less abundant and less potent. So we take stem cells at the time of birth. We're not using aborted fetuses. Now we learn that we could, and originally we used to take stem cells directly from the patient. I would harvest it from your bone marrow or adipose tissue, and then I would put it back precisely where we need it. In the example of treating arthritis, I would inject that right back into your knees. And when I first got my start, that's how all doctors did stem cell treatments. We would take it directly from the patient and put it right back into you when we would concentrate it and get them, then we would put it right back where they're needed. But now that we can get stem cells from the umbilical cord and from the placenta, from a donor mother, these mothers go on to have a live, healthy birth. So we're not taking them from aborted fetuses, we're taking them from a live, healthy birth. And those stem cells have a lot of the same nature, qualities, properties of the embryonic stem cells without any of those ethical concerns. Especially here in Utah, where I live, there's a lot of young people getting a lot of births here in Utah. So now we can take those stem cells, we're going to deposit directly where they're needed, thousands of times more stem cells than what your body will send in. And plus these are younger, more potent, more immature stem cells than your aged adult stem cells. So the results just have gotten better and better once the science has evolved.
Well, how is that safe though? You're taking it from a mother. Do they have to match blood? Is there any type of risk of infection?
Well, to date, there hasn't been a single incidence of infection or disease transmitted from the mother to the recipient. So these mothers go through a very vigorous screening process to determine whether they're even a good candidate to donate. So these mothers are scheduled for a C-section, and they're asked just before they go to the hospital, are you willing to donate your placenta or umbilical cord for doctors to use to regenerate different parts of the body? And so they go through a very vigorous screening process as outlined by the FDA. And then these cells are also what we call immunoprivileged. What that means is that there's been no antibodies or antigens formed against these cells. Because they're taken at the time of birth, no antibodies have had a chance to form. So when you are getting a kidney donation or liver transplant from another individual, you do have to match up the antibodies, and there are compatibility issues. But with the stem cells, since they're immunoprivileged and no antibodies have been formed, it's kind of like the universal blood donor. It can go into any human being and become your own cells. So to date, there's been millions of uses of stem cells in this regard, and there hasn't been a single incidence of rejection or infection or disease transmitted from the mother to the recipient. So it's got a very high safety profile.
So they're not doing bone marrow or adipose, and I know adipose was controversial with the FDA. Well, first of all, why was it controversial, and why aren't they? Has this completely replaced that?
Well, there was really no controversy with the adipose tissue. Really, the controversy remained with the embryonic stem cells. I wasn't aware of any controversy with the adipose tissue. And we can still do it that way. There are doctors that still do stem cell treatments using adipose tissue or bone marrow, because we're taking them directly from the patient and putting them directly into the same patient. And that's always been FDA approved. And when I say FDA approved, I don't want to get into semantics or too much of a discussion of what FDA approves or disapproves, but it fell under it was compliant with FDA regulations is the best way to put it. But having said that, once we learned that we could get a better quality, younger, more immature, more potent stem cells from the placenta, and then later we learned we could get even better quantity and quality from the umbilical cord, now there's no ethical dilemmas. It's FDA approved or falls within FDA guidelines, and you have a much better chance at a good result. It's not that you can't get a good result using someone's adipose tissue. When I first got my start doing these treatments 10 years ago, I got excellent results using adipose tissue or bone marrow. But now the results are that much better. Plus, I don't have to put the patient through the harvesting procedure. And those doctors who are still offering adipose or bone marrow stem cells, usually they're doing it because there's more profit involved. When I use the umbilical or embryonic stem or umbilical or placental stem cells, I need to pay the company who's providing them to me, money for those stem cells so then I can place them in another individual. When you're using your own bone marrow or adipose tissue, those are free. We're taking them directly from you and putting them right back into you. So there are some companies that will still offer that because they can still charge the same price as what I charge for using a much better quality stem cell. And there's more profit, just give you a general idea. If you're comparing a stem cell company that is a regenerative clinic like mine that is offering adipose or bone marrow stem cells, you should be paying about $2,000 less than when someone is using higher quality umbilical cord stem cells. And that's the main reason some people still hold on to bone marrow or adipose tissue stem cells. It's mainly to keep the cost down for patients or to make more profit.
So one of the buzzwords we're hearing a lot about is exosomes. How is exosomes and amnio fluid different from stem cells, or is it the same thing?
Exosomes are part of the stem cell, okay? And the jury is still out how much more useful exosomes are. Can you get a higher quantity of exosomes if we just take the exosomes and don't use the stem cell? But the stem cell has a lot of important properties in addition to what the exosomes do. The exosomes help with the chemical signaling. Okay, so I'm gonna back off. I'll come back to that question, but I'm gonna back off for just a moment and go on a tangent here. So when I'm regrowing cartilage in the knee, for example, depending on the different parts of the body, there are different structures that are responsible for causing pain in the body. In the knee, for example, it's usually the cartilage or meniscus that causes pain. In the shoulder, it's usually the rotator cuff tendon that causes pain, okay? So different structures for different parts of the body. And so when I'm trying to regrow cartilage in the knee, for example, I'll never regrow all the cartilage you had when you were 12 years old. I will not achieve that goal. But what I usually do is regrow enough cartilage to turn the clock back to the point where that knee started bothering you. I can usually achieve that goal. But the other way that stem cells work is it helps change the chemical signaling within that microenvironment. I consider each joint to be its own microenvironment, the knee, the shoulder, the back. You can think of it as like a coral reef where you've got this symbiotic relationship between the different organisms and they all work together to make that coral reef thrive. Well, a lot of what the stem cells do when I place new stem cells into a joint is it shares chemical information with your native cells so that the native cells now aren't as agitated or inflamed by the cartilage or the arthritis that is there. So again, going on a slight tangent, again, why is it that some people suffer from arthritis and some people don't? We all have arthritis, and some people have severe arthritis in a knee or in a hip in an area, and they don't even know it. It doesn't cause that much pain in that individual. And some people have a lot of pain from the arthritis that's present. And you can have severe arthritis, but very mild pain. And you can have mild arthritis and suffer severe pain from that mild arthritis. So when we talk about arthritis, we're not talking about the pain involved, we're talking about the condition of the cartilage. And when someone does have more pain than another person, it really has to do with your body's native cells and how they're interacting with the arthritis that's present. If your body considers it a big insult, it'll create an inflammatory response, and then you'll experience more pain. But if your body's native cells don't consider that arthritis that's present to be particularly aggravating, then you won't have a lot of pain. So part of what I do when I place the stem cells in, the stem cells, and this is where I circle back and talk about the exosomes, the stem cells have exosomes on them that are released, and that helps with the chemical signaling. So part of the way that these stem cells work so well is that not only do I regrow cartilage, but I also cause that chemical signaling to be better and not so aggravated by whatever arthritis is remaining. So then the next question from the scientists are, why not just use the exosomes? We can help with that chemical signaling. Maybe we can harvest more exosomes, place more exosomes, and get better chemical signaling. And that may be true. But in my mind, it doesn't seem to, I don't think it's as promising or as wonderful a treatment as is hyped. Why? Because the stem cells, by stem cells have exosomes on them. So why would you take away all the benefits from the stem cell and just use the exosome when when I am doing a treatment, I am placing exosomes with the stem cells because the two are together. I don't see a lot of, I haven't seen a lot of good explanation or studies or understand or a big appreciation of why it would be better to use just the exosomes and not use the stem cells. So at this point, I'm using the stem cells with the exosomes because again, when I do a treatment, you're getting exosomes also. And the jury's still out whether it's better or not to add additional exosomes, which some companies are now producing just the exosomes to place in an area.
No, that's really interesting. But another question though is, it seems sometimes I feel like when it comes to stem cells, there's a lot of claims out there, and people say, well, we're in the wild west of stem cells. It's like it's the next big thing, but there are, there was a company down here in South Florida that got in trouble for using stem cells for eyes. What's the regulatory outlook, and where's this all heading?
I love that question. And that's one of the things that I actually bring up to all my patients that come in for a consult. It is somewhat of the Wild West, because here's the reason why. When I first started learning how to do these treatments, well, if we have time, I'll circle back and explain how I got interested in doing these treatments in the first place. Maybe I should just briefly touch on that.
Touch on it now.
All right. So I was an emergency room doctor and a toxicologist for many years before I started doing regenerative treatments with stem cells. And the main reason I got into this field is because I was looking for a solution for myself. I played a lot of sports. My life revolves around sports and fitness. And when I was younger, I played 3 contact sports: hockey, soccer, and lacrosse. And I had a lot of knee injuries. My knees kept dislocating because I was born with weak ligaments, and these contact sports, they kept popping out of place. By the time I was 17, I'd had 7 knee surgeries between the 2 knees. I had my first knee surgery at age 13. And the last one at that time was major reconstructive surgery. And the doctor told me, who did my surgery, he said, "Bill, you just got to quit contact sports. You'll blow it out again if you do it, if you go back to playing those." So that was a tough pill to swallow at age 18 when I was planning on playing 3 sports in college. But needless to say, I just turned my attention to other sports that I really enjoyed that were non-contact sports. One of them was skiing. I loved to ski, and I skied moguls for the next 10, 15 years. And it seemed counterintuitive. Here it is, I can't play contact sports, but I was skiing bumps all day long and jumping off cliffs and not having a problem. My knees were not dislocating when I was doing those sports. But I also had advanced arthritis at age 17. And a lot of people don't think of arthritis as a young man's disease. But if you have a lot of trauma to your knees, you can have arthritis at a young age. But like the story I told you earlier, I did not suffer from pain from arthritis, but I had severe arthritis. I didn't suffer from pain till many years later. So, but I also was in medical school by this point. I was in my mid-20s. I'd already decided to go into emergency medicine. And so I always knew that someday the cartilage would wear down to the point where it would bother me. And I didn't want to have to give up skiing. I didn't want to have to give up these sports. So I always kept my ear to the grindstone. What are these different methodologies that are being invented or being learned about by the medical community to regrow cartilage? Many different things come and went, and nothing was universally successful until stem cells. So once I learned about the stem cells, I went and had the treatments done on myself. And then I was like amazed how well it worked. And I thought to myself, why aren't more doctors providing these to more patients? Why don't more patients know about this? And that's how I started learning how to do the treatments myself, getting the training, and then providing them to patients. And for a while there, I was doing it on the side. About half my practice was emergency medicine and half was regenerative medicine. But then, of course, the regenerative medicine evolved. As more people learned about these treatments, more and more patients, then I basically just stopped doing emergency medicine and started doing this full time. But when I first started doing these treatments, I was the only medical doctor in Utah doing them. But now there are chiropractor clinics, acupuncturist clinics. A lot of different doctors are adding stem cell treatments to their practice. And that's where this whole wild, wild west thing comes in for 2 reasons. Number one, a lot of these clinics don't get properly trained on the methodology of how to do these treatments. I follow a tried and proven technique called prolotherapy, which has been around for many years, but a lot of people don't know it. And for example, when I treat a knee, it's about 15 injections into the knee because I'm treating the whole knee comprehensively. I'm treating the tendons, the ligaments, the cartilage, and the meniscus. It's not a one and done injection and being done with a treatment. When I treat a back, for example, a lower back, it's about 40 to 50 injection points in that one single treatment. Most of these other clinics that are popping up, first of all, a lot of these clinics, the people who run them are not medically trained. They're not doctors, actually. They're businessmen, or they're chiropractors or acupuncturists that can't actually do the procedures themselves. So they hire a doctor or a nurse at a low hourly wage to perform the treatments for them. And so they don't get the proper training and so they don't get the success rates of someone like myself. And then the next problem is, where do you get the stem cells from? So like I told you earlier, I purchased my stem cells. I no longer do the adipose or bone marrow harvesting. I could do that and charge a less price for it. But most people want to get the very best product out there and be done with it as quickly as possible for as little money as possible. If you go with the inferior treatments, you may need to do more treatments and it take you longer to get there. So it seemed to make a lot more sense just to use the very best quality product. But then once we can purchase the stem cells, how do you know you're getting good quality stem cells? There's a lot of different companies now that can provide stem cells to the doctor. And that's where I use my toxicology background. So as a toxicologist, we're very good at vetting these types of companies to know, am I getting a good quality product or not? And so almost once a month, a new stem cell company will approach me and say, Bill, I can get you better quality stem cells at a better price. And who doesn't want that, right? But then I say, great, give me a sample, give me some, and I'll go have it tested. I'll check it out. And I want to look at your lab analysis, look at your composition. And
never hear from them again.
Well, no, they do give it to me. And then I go and I send it to a third-party lab in Ohio, the most reputable lab in the country. And whenever I do this, very rarely do the stem cells come back at the same quantity and quality of what they tout. So it's very hard to duplicate. So usually a lot of the stuff is just crap. I'll be the first to admit. Now, I shouldn't say that because they usually have some healing and growth cells and other things that can help the patient get better, but it's far inferior to what they claim. And that's really what we're talking about when we say wild, wild west. You don't know the quality of the practitioner, if he's trained properly, of how to do the techniques properly, plus the stem cells. You don't know if you're getting good quality stem cells. So I do vet every company. The company I currently use happens to be a local company here in Utah, but they're also one of the biggest manufacturers in the country. And I'm able to go to their lab, meet with the scientists, know their techniques, but more importantly, I have yet to have another stem cell company come across my desk that can provide me with a better product. And that's really where you run into the problem when you're comparing different clinics. It's the average person is not going to be able to know whether they're getting the best quality stem cells or not. And even doctors who are offering these treatments in their clinic, they're usually not vetting the companies properly. They're just taking the companies at their word, and their word cannot be duplicated many of the times. So that's where the problem comes. You need to go to someone who's reputable, has a tried and proven reputation, plus has vetted the stem cells, and you know you're getting the very best product.
What should a patient ask for? If I'm shopping around, I'm trying to find the doctor's good, but what makes a good quality stem cell product?
Okay, great question. So everybody that comes to my clinic gets a handout, and I've done talks on other programs too about what you should look for in a stem cell doctor. There are 5 things. Everybody, the 5 most important things you need to look for in a stem cell doctor. I'll touch on them right now. And since I already expanded, I'll be more brief. Number 1, you want the clinic to be run by a medical doctor, MD, versus chiropractor, acupuncturist, or some other entity. Those guys do great work in their own field, but this is a medical procedure. You want to go to a medical doctor. Secondly, you want a doctor who's had extensive training. They should have done at least 4 years of residency, fellowship. You know, most orthopedists have done 5. I've done 7 years of fellowship and residency training. So you want that doctor to have, a certain amount of credentials, okay? Number 3, you got to make sure that the stem cells that are being used, I talked about earlier, are the highest quality. So you've got to vet what stem cells are being used. If they're using bone marrow or adipose tissue, you should be paying a lot less money than if you're using a good quality umbilical cord. And then, then you want a doctor that's trained in the prolotherapy technique. So that technique I told you where I do 15 injections in the knee, it's not just a single injection and you're done. That's called prolotherapy. And doctors that came before me, many years before me, figured out what different structures are responsible for the function or the pain in a joint, and what do we need to hit and treat to make the pain go away and the function better. And that's a technique called prolotherapy, and you cannot learn that in a weekend. I'm actually the first board certified doctor in interventional orthopedics here in Utah. It's a relatively new board certification, and it's only been around for a couple years, but that's really what you strive to search for, is a doctor who's actually trained in the prolotherapy technique. And that's, I think, the fifth of the different things that I said. So I lost count there, but I think those were the high points. And those are the 5 things that you need to look for when you're searching for a stem cell clinic. And there are good doctors. Here's the problem. There are some great doctors. I train with good doctors. I belong to the American Association of Orthopedic Medicine. And there are doctors that have been doing this longer than me that I train from, and they're fantastic. The problem is that they're scattered around the country in different places. It's hard for the average person to find those doctors. So it's not uncommon for people to travel, from different parts of the country, fly in just to get a treatment from me because they know they're going to get a good, high quality treatment. And people fly in from other countries. Now, I'm not saying you have to do that, but the trouble is that it's hard to find the right doctor locally in many places. A lot of the good doctors are located on the East Coast, for example. In the Northeast, I would say there's a good amount of doctors. There's some in Florida. They're scattered around, but they're hard to find. But I would say, if you want to look at my website at utahstemcells.com, I do have 5 most important things you should look for when searching for a clinic, and that can help guide you.
Yeah, no, we have a lot of stem cell doctors here. I've used Dr. Parita up in Boca. He's good. Dr. Joseph Parita.
I'm sure there are some good doctors. I meet these doctors at the conferences, and so I know they exist. It's just for the average person, it's sometimes hard to find.
Yeah, but no, I think it's very interesting of reading about all of this. Now, one thing I read is that this is going to be used for COVID. And have you seen anything like that?
Well, don't get me started about COVID. I could do a whole podcast on the whole farce of the coronavirus. So just so everyone out there who's listening, the coronavirus is a lot like the common cold. So we don't really need to have all these exotic treatments. However, there are plenty of very, very good treatments that we already have for corona. And yes, stem cells can definitely be very beneficial. I have had patients, that have had lung problems or other issues. So we talk mostly about musculoskeletal treatments, but my practice has evolved into a regenerative medicine practice. So we can use IV stem cells just for health and wellness. And of course, it would help with immunity. It helps with autoimmune disease, helps with a lot of different things, but it can make the lungs strong and healthy. So a lot of times the coronavirus in particular attacks the lungs, right? And people who have underlying lung conditions are susceptible to the effects of corona. If we do IV stem cell therapy on those patients, of course, we're already using IV stem cells to treat COPD, and those are the patients that are at risk of really having trouble with the corona. And so absolutely it can help that. We already know it works well for those conditions.
No, I think I think stem cells are fascinating. I really appreciate the time, and we can do another whole podcast on COVID. That'll be fun.
I would love to, because here's the story. And we're doing this is a live podcast, or I'm sure this is going to come out. If a doctor like myself comes out and tries to give statistics of what's your risk of dying from coronavirus versus a lightning strike, most people have a much better chance of dying from a lightning strike than the coronavirus if you're under the age of 50, for example. If you give statistics and give some sort of, try to give some comfort to people about what can we do about the coronavirus. Our masks do absolutely nothing. The virus goes right through the mask. Social distancing does nothing. But if we talk about all these things, you will get censored. 95% of doctors believe what I believe, that the coronavirus is much more like the common cold than it is a more deadly virus like Ebola. We also believe that the unintended consequences from the shutdowns, from the quarantining is killing millions of people, thousands of more people, ruining lives. It's going to cause a lot more damage than just letting the coronavirus do its thing. Now, if I say that, my YouTube channel will be censored. Facebook and censorship is a horrible problem right now. So that's why that's why the general public isn't hearing doctors talk about this. I can tell you that 95% of doctors are pulling their hair out and can't understand why we're doing any of these things. And we're the ones that are the most, that's our business, is to keep people alive and helping with health. But they will only put the 5% of doctors that will promote the farce in the agenda, the propaganda that either the news programs or the governments want to spread. Those are the only 5% of doctors that you'll hear. 95% of the doctors believe what I believe, but it's very hard to hear that voice because it'll get censored.
We always thought that there'd be politics behind stem cells. It's really nothing compared to COVID.
Correct.
So I appreciate the time, and
my pleasure.
Got to talk again. I really
there's so much we can talk. Just to throw it out there, we can talk about this another time. My practice has now evolved into a regenerative medicine practice. I got my start doing stem cells just on orthopedic stuff. And again, we learned so much in that arena that now we can use it to restore vision, hearing, burn victims. We can use it for IV stem cells to treat multiple sclerosis, Parkinson's, COPD, autism. There's so many things that we can now use stem cells for. And my practice has evolved to treat a lot of different things, where it really all started with the musculoskeletal treatments.
Even sexual enhancement you use it for.
We could talk a lot about that. There's nothing better for treating ED in men, or in females. We call it in the men it's called the P shot. In the females it's called the O shot. It works great for urinary incontinence after multiple childbirth. A lot of women start to leak a little bit, but it also helps a lot of those women have either painful intercourse or difficulty reaching orgasm or having good orgasms. And when we inject PRP and stem cells into the vagina, people get tremendous benefits. And it all sounds scary and painful. Anytime anyone's going after your privates with a needle, it sounds scary, but we numb everything up. We have a lot of different ways of making it very painless and pleasant and comfortable.
It sounds fascinating. So I think this is the future of medicine. I really appreciate the time.
Yes. Thank you so much. I really appreciate talking with you as well.
Thank you, Dr. Bill.
All right. Take care.